Hello and good evening once again. Dr. Alalade here at AsktheGynaecologist, and tonight is a wonderful one. I'm delighted to be here, and you can see that on my face. My name is Dr. J. You're one of your admins here at AsktheGynaecologist, and tonight I'll be talking about recurrent miscarriages. So if you're free, join me quickly, and let's have this talk together today. If this is your first time joining Ask the Gynecologist on our live show, I want to say set your alarm, set your buzz to always buzz you whenever I'm going on live. Whenever I go live, I try to expand on topics on the recent discussion I've had with patients to answer most of your questions. Once again, I want to introduce myself to you. Dr. Alalade is the name. Thank you, Z Light. Thank you, Gladys. Sultan Belladonna, all the way from Texas. Yeti Glam and Gladys 266. And thank you guys, wonderful ladies, for joining once again this afternoon, this evening on Instagram. And if you're watching me on Facebook, I want to say welcome once again. I can't see any of our viewers on Facebook. I hope I'm live on Facebook. If so, let me know. Give me some thumbs up there. We're also recording simultaneously for publication on YouTube shortly. If you're not yet a subscriber to our YouTube channel, this is a time for you to join and be a follower, free of course, on our YouTube channel, and you won't miss any of our discussions. Tonight, we'll be talking about recurrent miscarriages, how to prevent them, how to prevent recurrent miscarriages. So let me check here if we are live on Facebook. I think we are live on Facebook. And unfortunately on Facebook, I don't think I can see any comment. So, but I'll wait for people to join on Facebook. Then I'll start talking. Thank you, Buchi Anita. Omotowan, Yeti Glam. Thank you. Good evening to you as well, Yeti. And thank you for being here at ATG, Ask the Gynecologist page. I'm just waiting. I think I'm having some issues on my Facebook. So let me check. Guys, I'll wait for people to log in before I start, okay? Let me quickly check on Facebook if there's any issue here on Facebook. Okay. Just hold on, guys. Hold on Instagram. Thrift Deals Abuja. Welcome. So tonight I'll be talking about recurrent miscarriages, the causes of them, and now to treat them, how to prevent them if possible. So just hold on there. Let me quickly log in on Facebook and see if we have any issues on Facebook, because I don't think I can see any viewers yet on Facebook, and that's unusual. So just hold on, guys. Just hold on for a second. All right. Okay. Right. I can't see myself on Facebook, I guess. So I'm going to restart the post on Facebook. So guys on Instagram, just hold on there. Just hold on. So I'm going to go live once again on Facebook. So here we go. Now, recurrent miscarriage is a very big topic, and a lot of people are definitely worried about it. Many women will have miscarriages in their lifetime, and I can tell you something from statistics that out of every 4 pregnancy a woman has, a quarter, one out of every 4 will likely be a miscarriage. And in fact, a lot of people do not even know that they had a miscarriage. They'll just think that, oh, my period was delayed. Suddenly my period came. I had a period that was much heavier than usual. Okay, this period is a bit heavier. That's okay. Most people do not even do tests of pregnancy because when they're not anticipating that they might be pregnant. So in most cases, most miscarriages are missed. And sometimes most miscarriages happen at home. The woman bleeds, passes the baby in early pregnancy, the bleeding settles down, she takes some paracetamol, she gets a scan a week down the line, everything is okay, and she forgets about everything and she moves on. So in most cases, most miscarriages do not even end up in the hospital. They end up at home and the woman moves on. So this is very common. So out of every 4 pregnancies a woman will have, 1 will be a miscarriage. That is to say, 1 out of every 4. This miscarriage is about 24%, 25%. Okay, so it's very common. Miscarriage is very common. It's perplexing, it's deeply painful, and it's stress on the woman because you thought you're pregnant, suddenly the pregnancy stopped working, and you have to start all over again. Sometimes most people will know that you're pregnant, and it can be unsettling for most women. Now, how can you prevent miscarriages? First of all, we need to know what is causing the miscarriage. Once we know what's causing miscarriage, then we can now work on how to prevent miscarriages from happening. Once we know what is causing the miscarriage, then we can think of how we can prevent miscarriages from happening in the first instance. So, what is the cause of miscarriage? First of all, I'm going to tell you something before we start this. And most people watching us know that in most cases, we don't know the cause of miscarriage. The number 2 commonest cause of miscarriages is obviously problem with the womb. Some people, I wish I could draw here, but I can't get, let me see if I can get my board to come clearly on the screen. Okay, anyhow, I'll try as much as possible. But first of all, if you have any abnormally shaped womb, if your womb has some structural abnormality, like massive fibroid in the womb cavity, mark my words, massive fibroids in the womb cavity, this can cause miscarriage. Sometimes a woman's womb is abnormal. A woman's womb has 2 cavities, okay, and it's abnormal. In such cases, it can't hold the pregnancy and it can cause miscarriage. So stuff like this can happen in the womb and it can increase or make miscarriage happen. That's number 1. Number 2, infections. Infections in early pregnancy, like bacterial vaginosis, they can increase the risk of miscarriage. Infections like bacterial vaginosis can increase the risk of miscarriage. Infections like syphilis, gonorrhea has propensity to increase the risk of miscarriage. You have an infection like malaria in early pregnancy that was not treated or inappropriately treated or not properly treated can increase the risk of miscarriage. Or malaria that's not treated on time, yes, they can increase the risk of miscarriage. If you are diabetic and your diabetes is not well controlled, your diabetes is poorly controlled, it increases the risk of miscarriage in you. If you got diabetes, the first thing you must do, in fact, before you got pregnant, if you're diabetic, is to get your sugar level perfectly under control. If your sugar level is perfectly under control, you get pregnant, the risk of miscarriage is lowered by almost 50% to 75%. If you have an infection, bacterial vaginosis, even before you got pregnant, even while you're pregnant, you must treat them with antibiotics that is essentially going to work for them as soon as possible to reduce that risk of you having a miscarriage in early pregnancy. Okay, another obvious reason for miscarriages is chromosomal abnormalities. Chromosomal abnormalities, like all these any abnormality chromosome-wise, chromosome not assorting and reassorting well, they can increase the risk of pregnancy not progressing well and leading to miscarriage. That is why we give people that are suffering from recurrent miscarriages, we put them on aspirin 150 milligrams even before they got pregnant and all through pregnancy to reduce the risk of miscarriage. And once you get pregnant, another reason for pregnancy loss, difficulty getting pregnant, and recurrent miscarriages is luteal phase defect. The progesterone is very low, so we can give supportive progesterone medications in early pregnancy to reduce the risk of miscarriages because of lack or reduced progesterone production in the body. Progesterone is necessary for placental function in early pregnancy. If you're having low progesterone, talk to me in the pregnancy services. I'll walk you through as per what to do to reduce your risk of miscarriage regarding that fact. If you have fibroids and your fibroid is more than 5 centimeters, in most cases, you need to take them out. Now, mind you, in fact, today in clinic today, I saw a lady, a lovely white lady. She has a 9 centimeter fibroid and another one 10 centimeter fibroid. That is as big as 2 of my wrists, even bigger, attached to her womb. And she is currently pregnant. She's about 28 weeks pregnant. So having massive fibroids can increase the risk of miscarriage and can cause infertility, but I've seen people with fibroids and they are okay. I'm just saying that having a fibroid can increase the risk of miscarriage. It doesn't mean you miscarry. Now, bleeding in early pregnancy is a sign of miscarriage. If you're pregnant and you saw bleeding down below, bleeding in your vagina, don't come and tell me that you're having a period. Nobody has a period during pregnancy. Nobody has a period during pregnancy. If you're bleeding during pregnancy, you are having the risk of miscarriage. Any bleeding in pregnancy carries the risk of miscarriage. If you put 10 women in a room and they are all pregnant, okay, and you put another 10 in another room that are also pregnant, and the first set of women are bleeding in pregnancy, the other set of women that are pregnant, the other 10 are not bleeding, okay, the story of the 10 virgins, remember. Now, these first 10 that are bleeding and they are pregnant, they have a higher risk of miscarriage. In fact, out of those 10 in that room, 60% or 70% of them that are bleeding in pregnancy will miscarry. But remember, some of them will bleed and they will miscarry. Out of that 10 of women that are in the other room that are not bleeding, they are also pregnant. 2 of them, 1 to 2 of them will miscarry and they will not bleed. So bleeding doesn't mean you're going to miscarry, but bleeding in pregnancy increases the risk. Bleeding in pregnancy increases the chances of you miscarrying. That is why any bleeding you see during pregnancy, you should report to the doctor. You should get scanned. It's not as if they're going to do any massive thing, no, but at least they're going to monitor you. Now, if you're bleeding in pregnancy, what we do is to monitor you appropriately, give you progesterone injections or progesterone pessary if necessary, but we can't do any operation to stop miscarriage in pregnancy. Like if you put 10 women together and all those 10 women are pregnant and they're bleeding, 3 of them will bleed and it will stop and their pregnancy will go fine. Another 3 of that 10 will bleed intermittently one time or the other through pregnancy and their pregnancy will go fine. Another set of 3 of them will bleed and they will miscarry. And the other one, we don't know. You have to leave it as unknown. So 3, 3, 3, 1. 3, 3, 3, 1. 30%, 30%, 30%, 10%. So if you bleed in pregnancy, you are not having a period. If you bleed in pregnancy, you are not having a period, you are likely to be miscarrying. That is why bleeding in pregnancy must be attacked. I think the reason most people get it confused is that people assume that every bleeding you have is period. No, bleeding is not always period. Bleeding could mean that you're miscarrying. So welcome once again to ATG. My name is Alalade. I think why people are not able to see me on Facebook is because I'm using my second profile to go live on Facebook. So I will change that next time. I'm using my second profile to go up on Facebook. And before I forget, this weekend, okay, it's the ATG seminar. The ATG seminar, the monthly August seminar, is this weekend, Saturday, 2 days time. It's going to be on male and female fertility boot camp. You want to get pregnant, you're not able to get pregnant, it's the time to come in and hear what you should do, what is missing in your life, what you should put together before you get pregnant and while you are on that journey of pregnancy. So you're going to learn those things. You'll be amazed how simple things that we think people know, people don't know. Or probably they're not told the right way, or they don't have evidence to support their belief. Anyway, let's continue back on this discussion. And if you're just joining us on Instagram, welcome once again. My name is Alalade, one of your team members here, and your moderators, and also your admin at ATG, Ask the Gynaecologist Online. By the way, it's going to be a year now. We opened the ATG laboratory, and the ATG laboratory is amazingly perfectly functioning well. And also, this is the 3rd month of the ATG IVF Center, and we are creating success stories. So if you're not yet registered for the ATG IVF seminar, if you need ATG IVF with us, you need IVF, is the time to get registered at the ATG IVF Center and start your journey on your way to motherhood, on your way toward motherhood. And the cost of the IVF has been reduced tremendously. We've dropped down our prices For IVF alone, IVF cost without drugs is just about 1 million now. We're making things cheaper. And in fact, if you've had any failed IVF from anywhere before, I will encourage you to join ATG and pay for the ATG IVF sessions and get your IVF done with us at our offices in Lagos. Now, back to your point. Back to our discussion today, causes of recurrent miscarriage and how to treat them. Remember, my last point was that chromosomal abnormalities can lead or cause miscarriage. What sort of chromosomal abnormalities? Any chromosomal abnormalities, any problem with chromosomes rearranging and resorting themselves in pregnancy. You know, when you get pregnant, your sperm comes with its own gene and with its own gene allocation. The egg comes with its own gene allocation. They mix, they reassemble, resort, and they keep rearranging each other accordingly. Okay, that is the union. That is the make of a baby. So at any point, sometimes in the genetic transcription and all that, things can go awry. Things can go not according to plan, and it develops into what the gene system can control gene mismatch. But sometimes the gene mispair is too overwhelming for the mismatch correction system in the gene pathway, and nature will say, okay, this pregnancy is not progressing well. I need to abort, and start all over again. And people have missed miscarriage. They don't even have any bleeding. The pregnancy just stops growing, and they end up saying, oh, I can't feel my feelings of pregnancy anymore. They get a test of pregnancy or a scan, and it says miscarriage has happened. Miscarriage does not need you to bleed. You don't have to bleed to know you have a miscarriage. You don't have to bleed to have a miscarriage. As far as there's no heartbeat in baby and baby has stopped growing, you have had a miscarriage. We have different types of miscarriages. We have what we call the missed miscarriage. In those days, we call it missed abortion. But now we've changed the term to call it missed miscarriage. That means that you've had a scan before. A missed miscarriage is an ultrasound diagnosis because you don't bleed, because it's not obvious bleeding. So missed miscarriage is a diagnosis made on ultrasound scan. So you've gone for a scan, and the scan says that you're about 6-7 weeks pregnant. You now went for another scan about 2 weeks down the line. The scan says that you are still 6 weeks pregnant, which is supposed to be about 8 weeks already. That means that the pregnancy is not growing, and they now even had insult to injury. They cannot find the heartbeat. At that point, that means that pregnancy has miscarried. We call that missed miscarriage because there was no obvious bleed, there was no obvious pain, and everything's hunky-dory as if nothing happened. It's missed miscarriage or missed abortion. Whatever you call it is the same. Thank you, Radiant Blessing or Soba. Thank you, Gloria, and thank you to all our moderators online now, supporting and assisting our clients, assisting our fan base, assisting our team members here. Thank you, guys. God bless you all. I can see Gloria, I can see Vivian, I can see Christina. God bless you. And also to our friends and lovely ladies watching me now on Instagram. Kemiti Store, Vicky Michaels, Erada Idovo, and I've got Machala Jason, Jenny Abe, 2018, Miss Lake, Onome 4B, and others. Thank you guys for watching us on Instagram. Okay, that is essentially the missed miscarriage or missed abortion. We also have incomplete abortion or incomplete miscarriage, and that one there must be bleeding. So you've had a scan, baby was not growing, suddenly you started to bleed, or you were bleeding heavily while you thought you were pregnant. We now scanned you and we see that actually when you were bleeding, you've passed part of the pregnancy tissue, but there's still some placenta tissue left behind in your womb. We say, oh, this pregnancy is miscarried, but it's incomplete. With incomplete miscarriage, if someone is bleeding heavily, we send them to theater as soon as possible and we do evacuation DNC. Okay? If another one we have is complete miscarriage or complete abortion. So there's missed miscarriage, there's incomplete miscarriage, there's complete miscarriage or complete abortion. So that person was pregnant before, she bled at home or in the hospital, she passed the pregnancy, she passed the baby under 12 weeks, and she bled a while, and then the bleeding has settled down, and we scan the person, we check the womb cavity, what we call the endometrial thickness, and the womb cavity, and there's no pregnancy anymore, and everything is settled as if there was never pregnancy there, or no pregnancy at all, we say this person has had a complete miscarriage. That is to say, nothing to do, case closed, time to start a new chapter and start trying again. Now, people always ask the question, okay, doctor, after miscarriage, when should I start trying? Today's topic is recurrent miscarriage and how to treat them. Sorry, I lost the text of today's topic. So today's topic is recurrent miscarriage and how to manage it. Recurrent miscarriage. So as I was trying to say, some people say, doctor, see what happened though. I had a miscarriage. I've done scan. The bleeding has settled down. I was bleeding. What should I do? In most cases, if we diagnose miscarriage, there are always 3 options available as far as your life is not at risk. Option 1 is to wait and see. Even if we can't find the baby's heartbeat, there's no bleeding, you're stable, you're not collapsing or being dizzy. If we can't find heartbeat in early pregnancy, I always tell people, let us, as far as there's no bleeding, and no pain, no bleeding that could mean that you're bleeding to death, no pain to suggest ectopic pregnancy and all that thing. If there's no bleeding, you're stable, you're okay, you're not dizzy, you're not in pain, massive pain, I suggest you wait and repeat that scan 10 days to 14 days time, because I've seen people that we thought that they've already miscarried, suddenly their baby is okay after a repeat scan in 10 days, in 2 weeks down the line. So first things first is conservative management. Do nothing, repeat a scan. And we do nothing as far as your bleeding is not heavy, you're not in severe pain, and you're stable, you're not dizzy or dying. So option 2 will be to give you some medications to make your womb contract and expel the pregnancy outside. Sometimes that could be a bit uncomfortable with sharp crampy pain. We can do that if necessary, as far as you're not bleeding to death and you're safe, and we can still follow you up in the hospital and do regular scans as necessary. Another last option is the surgical management, which everybody knows here as D&C, where we call D is for dilatation and curettage, where we open the cervix, get a tiny curette into the womb cavity and scrape out the pregnancy, whether by curetting and scraping out the pregnancy or by suction. There's a suction we have, or a syringe, Kalman syringe, to suck out the pregnancy. We can do that. Those are the 3 ways to manage miscarriage. Do nothing, medical treatment, or surgical treatment, where we put you to sleep or you're awake and we use some syringes or suction to suck out the pregnancy. Now, whenever somebody has a miscarriage and we suck out the pregnancy, we don't usually do post-mortem because everything comes out in clumps. What can be done on that pregnancy tissue is what we call chromosomal analysis, where we can study the pregnancy tissue, placenta tissue especially, to see if there's any obvious chromosomal abnormality that has caused this miscarriage that we can see and get more information to advise family to seek genetic counseling before you get pregnant, or to advise other member of family. Okay, that is about miscarriage. How do you prevent miscarriage? Once you know you have an infection, treat them on time. If you're pregnant, you see any infection in your vagina, offensive smell, bad odor smell, treat infection as soon as possible. You're pregnant, you have malaria, treat it as soon as possible. Malaria must be treated in pregnancy and even outside pregnancy. And more so, if you're pregnant, you have malaria, it must be treated aggressively. You must treat malaria in pregnancy aggressively. You must treat malaria in pregnancy aggressively more than any time. The best time to treat malaria aggressively, and one of the times to treat malaria aggressively, is during pregnancy. That is paramount, very sacrosanct, undebatable. Thank you, Miriam, Mama Kans, Jade Nadano, Sapphire Dietitians. Thank you, my sister. Onoja, Debbie Onoja, for being here. God bless you, Sapphire. Smart and Fabulous, thank you. Praise Unworuka. Thank you, guys. There's a question here on Instagram, and that question is from Jason Makala. She says that, please, I'd love to send you the result of just concluded histology test my wife did after miscarriage. Help me. This is her second miscarriage. She's just 26 years old. Please help. Makala Jackson, can you send an email to atgservices2018@gmail.com? I'm texting the email down below. So send an email to that email, and then we'll take it from there. Moshibaratan 14, thank you. Welcome once again. On Facebook here, we have a question from Etukudo. is saying that if labor does not come on or before the EDD, what should be done? EDD is expected due date. If labor does not come before due date, there's nothing to be done. As far as baby is healthy, as far as baby's environment inside is not compromised, as far as the blood flow in the cord to baby is okay, and baby is not suffering, and baby is too small for size, you don't need to do anything. Once the fruit is ready to drop from the tree, it will drop. Once the fruit is ripe and ready to drop, it will drop. But if you have not started labor, okay, after 7 to 10 days past your due date, in most cases 10 days after your due date, if you haven't gone into labor 10 days past your EDD, then we need to induce you. But during those 7 to 10 days, we need to be keeping an eye and monitor baby closely, okay? But after day 10, that is 10 days following your due date, you haven't gone into labor, you must be delivered as soon as possible. We don't want you to go over 12 days past your due date, because there's a risk that placenta will not be functioning well and it can increase the risk of death to baby. Doctor scan of 6 weeks, 6 days shows sac empty. Something to be worried about. Chocolate beauty? No, not yet. I know, understand, they can't see anything in the sac at 6 weeks. The best thing is that as far as you're not bleeding, as far as you're not in pain or dizzy, wait and repeat that scan 10 days to 14 days down the line. In most cases, if the pregnancy is okay, it will show. If after that repeat scan in 14 days or 10 days, there's still no pregnancy, that means that the pregnancy is not growing. Because if you're actually 6 weeks pregnant, pregnancy should become 8 weeks by that time, and it should be visible on scan. So if you want to follow me, repeat the scan in 14 days. Doctor, thank you so much, Precious Ezine. God bless you too. Thank you, Adekemi Adeneji. Oju Obeokuta Unwodika. Thank you, Etukudo, for your question here on Facebook. There's a question here by Yusvel Silver. We discovered through the last test I did that I have lupus. What is the risk of getting pregnant again with it because I have miscarried not quite long? Lupus has increased risk of miscarriage, and lupus increases the risk of recurring miscarriage. If you got lupus in pregnancy or lupus before you got pregnant, you should be put on Clexane and aspirin to reduce the risk of miscarriage and to reduce the effect of lupus in your body that can cause miscarriage to baby. Thank you so much for your question, Silva. I think we have more questions down the line here. Let me quickly refresh my page. Thank you, Gloria. Thank you, Agnes, Oji. Thank you guys for putting all this on the screen. Doctor, please, what is the best way to boost progesterone, and what progesterone injection should be given immediately one takes in? We use Cyclogest, their Autogestan, and so on and so forth. But I use Cyclogest, and Cyclogest should be taken as soon as you get pregnant if you have history of recurrent miscarriage. Okay? Thank you, Alalade Pearl. Thank you, Chocolate Beauty, for joining. Do we have more questions on Facebook? I need to answer more before we close this discussion tonight. Princess Khalifa, what's your question again? Please give it to me. Kemi Store is saying my menstruation is very light. What can be the cause? As far as your period is regular, I will leave it alone. If your period is regular, don't spend unnecessary money on investigations that are not entirely necessary. But if you're entirely worried about this, your light period, then the best thing will be to do ultrasound scan and to check into your womb cavity. And if ultrasound scan is not giving us much information, we might need to consider doing hysteroscopy. Hysteroscopy is a tiny camera that looks inside, into the cavity of your womb. So hysteroscopy is more detailed, and it sees and it can be able to treat anything wrong in your womb cavity, fibroids, polyp, and so on and so forth. And we do that now at the ATG IVF Center in Lagos. So if you want to do your hysteroscopy to look into your womb cavity, or to do ultrasound scan, we have the equipment to look into your womb cavity now. What is the effect of hyprolactin? Hyprolactin in your body makes you not to ovulate. Hyprolactin in the system of a human being is designed to tell the brain, don't ovulate. That's the problem. Gift Motas is saying, what can possibly be the cause of a woman being pregnant, but the pregnancy is not visible on scan? She's as far as six months. If you're pregnant, okay, follow me, and you are 6 months pregnant, okay, and you know that you are pregnant, you've missed your period, you don't test for pregnancy is positive, and they can't find your pregnancy at 6 months, please go to somewhere else and get a scan done. If you've not done test for pregnancy, it's just that some people say, I feel as if I'm pregnant. I feel as if I'm pregnant, but I've not done test for pregnancy, I've not done a scan, and I just think I'm pregnant. I know I'm pregnant. I'm going to buy baby things. My sister, you are pregnant. Okay, I agree. I'm not arguing with you. But do a test of pregnancy. Just pee your urine. 200, 300, 500 naira. Buy test of pregnancy strip and do test of pregnancy. I agree in faith with you, but do test of pregnancy. And if you're in this 6 months pregnant, that pregnancy is big enough to be discovered on scan, except that scan is fake, or that person scanning doesn't know what they are doing. Okay, so there's nothing hidden. You can't hide pregnancy. You can hide sex. You can't hide belly. What drug is safe to treat infection in pregnancy? What infection are you treating? Divine Jumbo. Infections can be caused by many things. Just because I look like a human being doesn't mean that I have the same name like another person's name. Everybody has a different name. So we need to know what infection you want to treat, then we're able to know what antibiotics to give for that particular infection. Virtuous Bukola, you said you've had several miscarriages. You know, question is done. What type of fibroid could cause infertility? Fibroids that are inside the womb cavity, we call it submucous fibroids. They have increased risk, increased chances of causing miscarriages and infertility. When is the right time for one who had miscarriage on the 9th of this month to start trying for another baby? As soon as you see, or as soon as you've seen your next period, as soon as you feel healthy, as soon as you feel emotionally stable, as soon as you feel like you can try again, you can start trying. Doctor, good evening. What is the benefit of taking glucose water close to delivery? I don't know. I don't know the benefit of taking glucose water close to delivery. It's as good as eating your food. Can aspirin be taken before pregnancy? Yes, it can, depending on what we want to use it for. On Instagram here, what is the cause of ectopic pregnancy miscarriage? How can one avoid it so it doesn't happen again? First of all, like any normal pregnancy, ectopic pregnancy, which is abnormal too, can miscarry. Like normal pregnancy will miscarry in the womb and will fall off. Ectopic pregnancy too can miscarry and the body reabsorbs it. So, and we don't know exactly why ectopic pregnancy miscarries. Okay. Now, what makes somebody have ectopic pregnancy? Watch my video on ectopic pregnancy. A previous damage to the tubes, previous infection in the womb, previous infection in the tummy, previous operation on the tube, previous ectopic pregnancy can increase the risk of having ectopic pregnancy again. Thank you. If you register at ATG Hospital, I'm not physically there now, but we have doctors there and IVF specialists there. They would see you and they'll counsel you. There's Dr. Chioma there, junior doctor, and Dr. Babajide is an IVF consultant. He will see you there on seat, okay? I'm not physically in Nigeria now because I can't travel now. There's so many things, okay, to consider. Is it safe to deliver at 36 weeks? It can be safe if depending on what's happening. For example, if your diabetes is not well controlled, if you're having blood pressure problems in pregnancy that we can't control, it could be safe and beneficial for you to deliver at 36 weeks. It all depends. There's not one answer or the other answer. Doctor, can period be delayed? Something. I can't see that question again. Ouch. Everything's coming fast now. I can't get them all. Doctor, what is the best letrozole product to use? I don't know. What is the best letrozole to use for ovulation? I honestly don't know. Christy Ikpo, thank you for joining. Doctor, what can cause blood stain, especially at 10 weeks? Is called threatened miscarriage. Bleeding in pregnancy, spotting in pregnancy is threatened miscarriage. Get a scan, check your baby, check your placenta. Doctor, do you store sperm at ATG laboratory? Yes, we do store sperm at ATG laboratory. Basically, you want to freeze your sperm, we freeze it there. Can someone who is 39, premenopausal, still get pregnant? Yes, you can. The lady in question still sees a period, but has grown tummy, and she counts she's 6 months, gone, but not visible on scan. My sister, my brother, listen to me. There's no hiding about pregnancy. Go to another place that they have a good scan and get another scan there. Okay? If you're pregnant and you have fibroid, we will see the fibroid on scan. I saw a lady today, she's about 28 weeks pregnant and she has 2 fibroids. I could see them on scan and she's about 28 weeks pregnant. I could see the baby. Pregnancy does not hide in nose. It does not hide in anywhere or in bum. If you're pregnant and you're 6 months pregnant, that's about 24, 26 or so blessed weeks. That pregnancy will be discovered. Let's stop kidding and lying to ourselves. Okay? Having a baby itself is a miracle. Sperm and egg join together and form a new human being. That is the biggest miracle I've ever seen. So there's no miracle in that your pregnancy is hidden. The miracle is that your pregnancy happened in the first instance. That is a wonderful miracle. Sperm came, egg came, bam, they form one being. Is that not enough? Now, pregnancy is not hidden. What God has done does not hide. So leave it alone. Come on, come off it. Let's come off that thing. Go to an office and get a scan. And let's stop lying to ourselves, okay? Is it normal for pregnancy to delay a year after a pregnancy? It's not entirely right. If you had a miscarriage for more than 1 year, you've not seen pregnancy, you should start checking and doing proper tests to know why you're not having pregnant. Why you're not getting pregnant. You're 7 weeks gone. You went for your first scan at 4 weeks. It says cysts. And to repeat in 4 weeks' time, you're not having any signs. Fetus is doing fine. That's fine. Amor, dinner, that's okay. That's okay. It's a question here by Mary Oko. How many weeks is the minimum of pregnancy? I don't understand you. The normal pregnancy duration in the world is 9 months or 40 weeks. The normal duration of pregnancy is 9 months or 40 weeks. Can labor start at 36 weeks? Yes. Labor can start at 36 weeks. Yes. Okay? Thank you, Princess Khalifa, for telling Jackson that we've answered her question. Makala Jackson, I've answered your question, I think, twice, except you don't like the answer. I've given you the answer to your question, I think, about twice. Thank you, Khalifa, for listening and paying attention in class today and always. Why is it difficult to get pregnant after many miscarriages at 35 years old? Probably your egg quality has depreciated. If you have eggs, but the egg is not very good, it's of low quality, it will produce low quality embryos that will probably lead to miscarriage. Okay? So therefore, if you have recurrent miscarriages, 35 years old, it's possible that the egg quality is not very good, okay? Agege, I'm not a pastor, I'm a sinner, I'm a sinner. I'm a sinner, but I want to know more of God, more and more. Thank you. Okay. Thank you guys for joining today and for listening tonight. I really appreciate you all. Now, if you've not yet registered for the ATG seminar for this weekend, which is the month of August 31st, this is time for you to get registered for the seminar. Click the links and the button below. Subscribe. Get registered for the seminar this Saturday, 8 p.m. is it. And you'll be definitely blessed. It's going to be a wonderful time, an amazing time. And there are lots of freebies I'll be distributing on that Saturday. So be there and ensure you are there. And set your alarm as well, okay? God bless you and have a wonderful day. Have a wonderful weekend ahead of you. And see you soon. Bye-bye.